Have you noticed students shaking out their wrist after a vinyasa, or maybe making a facial expression that looks like they might be feeling pain, or even telling you before class that they have a wrist thing and they're not sure what to do about it? Have you tried cueing them to spread their fingers wide, to press through the knuckles or their finger pads, or maybe have them recheck their alignment? And sometimes it seems like it helps, but sometimes it doesn't. Well, there's a really important reason why it doesn't, and I'm going to explain it to you. I'm Monica, and I want to talk about what's actually happening when students experience wrist discomfort in chaturanga, why the standard modifications don't always seem to work, and what you can offer instead that will actually serve their bodies. So let's start with the wrist itself and what chaturanga is asking it to do. When a student places their hands on the mat and moves into chaturanga, their wrists need to move to roughly 90 degrees extension. That's the angle where the hand is perpendicular to the forearm, which is what happens when you have your palms flat on the mat and you lower your body weight over them. So for many students, that position is completely fine. They can negotiate this movement. The wrist has the available range it needs, and the movement feels natural. But not everybody owns 90 degrees of wrist extension. And for some students, that's not a flexibility issue that will change over time or practice. It is a structural issue, and it's how their wrist and their bones are situated. Wrist extension is limited by two different things, and understanding the difference matters a lot in trying to understand where the pain is coming from. The first is a soft tissue restriction. This is what most of us think about when we think about flexibility. The muscles, tendons, and the fascia around the wrist joint have a range that they're comfortable moving through. And when we push past that range consistently, those tissues, they kind of let us know. With soft tissue restriction, there's usually some potential for change over time with appropriate conditioning and gradual load. You can see this change happening over months of practice, and your students might eventually find more ease in weight-bearing poses. The second type of restriction is skeletal, and this is important to understand. The wrist is made up of 8 small bones called the carpals, and the shapes of these bones, along with the way that your radius and your ulna articulate with them, create a ceiling on how much wrist extension is available. And so when someone reaches that bony in range, they're not going to get more extension no matter how much they stretch, how much they practice. Forcing past it doesn't create more space. It compresses the joint structures, and over time, that compression can become a problem. So, how do you know which type of restriction you're dealing with? Well, there's a simple way to get a sense of this. When you or your student reaches the end of their extension range, what does it feel like? A soft tissue restriction typically has a springy quality at the end range. There's tension, but there's also a sense that there's tissue pulling back. A bony restriction, on the other hand, feels more like you've simply run out of space, run out of road. It's a firm, hard stop with no give. The student will often describe it as feeling blocked rather than tight. This matters so much for how we teach because if we keep cueing a student to flatten their palms, press more evenly, and hold their position when they've hit a bony in range, we are asking their joints to do something that their anatomy will not permit. And we can cue that using the most precise language in the world, and they can try all sorts of workarounds, and it's still not going to help them. What they need isn't better technique within the same position. What they need is a different position altogether. So what's the solution? One of the most helpful modifications for students with limited wrist extension is fists. Instead of placing their palms flat, students make loose fists and place their knuckles on the mat. This naturally changes the angle of the wrist, reducing the amount of extension required significantly. Students who've been struggling with wrist discomfort for years often describe this as the first time chaturanga or plank has ever felt accessible to them. It's a simple shift that respects their body's limitations. Another option is yoga wedges or a rolled mat or a blanket placed under the heel of the hand. Elevating the heel of the hand reduces the degree of extension, which does the same thing as the fist modification. Some students find this easier than making fists, especially if they're also navigating hand or finger sensitivity. It keeps the palm more open while still reducing the load on the wrist. A third option, which might be available for some students, is to slightly walk their hands more forward on the mat. Now, this makes holding plank a little bit more challenging because the wrists are in front of the shoulders, but it does reduce slightly the amount of extension in the wrist. I would suggest skipping chaturanga with this hand placement and transitioning straight back to downward facing dog. This is helpful for reducing the amount of weight bearing on the wrists as well. A fourth possibility is to just simply not do chaturanga at all. You could cue to skip the flow altogether and teach students differently. Chaturanga is one expression of a transition. It's not a requirement for a meaningful practice, and students who've been pushing through wrist pain to keep up with the flow often feel an enormous sense of relief when we give them clear permission to move differently. The way we offer alternatives really matters. When we say things like, if you have wrist issues, or for those of you who need a modification, we accidentally make students feel like they're the exception or the problem. A more helpful framing is just to offer these variations as intelligent options for different students. Something like, you might choose to work on your fists today, especially if your wrist would appreciate a different angle. Say that to the entire class as opposed to saying it to one student will help to normalize it as an option for any student in your class to try. If you or your students are forcing movement around poses that hurt, you'll probably eventually hate the pose, skip it altogether, or even stop practicing yoga asana altogether because of the pain. I think it's so important to help students understand what might be happening in their body and offer them a useful alternative, not just vaguely encouraging them to listen to their body without offering an option that might actually work for them. Understanding the difference between soft tissue and skeletal restriction, recognizing some of the limitations are permanent and that's completely okay, and knowing what to offer when the standard cues you give aren't working. This is what it means to teach in a way that truly serves all of the students in your class. Wrist discomfort in chaturanga is so common that we can start to treat it as normal, as just part of the practice that students have to push through or work around on their own. And it doesn't have to be that way. So understanding what's actually happening anatomically will help you become the teacher who can help the students that other teachers can't. If this kind of anatomy informed teaching resonates with you, this is exactly the type of content we explore in the Teaching Students with Injuries mentorship. Understanding how bodies are actually built, why certain poses create pain for certain people, and what to offer when a student needs something different. The link is in the description if you'd like to learn more. And if you found this video helpful, I'd love to know in the comments whether you've seen students with wrist pain come up in your own classes and what you've tried to alleviate it. Don't forget to subscribe because I've got more teaching videos that will help you understand your students and their experience in your classes.